Happy holidays, everyone. Back to the case of the week. We were off for 2 weeks celebrating. Had some interesting cases build up over the last couple weeks, so I may do 2 on this go around. I'm going to do an endometriosis week or a PCOS week. For this one, this is a really interesting one. You don't see this too often. I had a patient come in with a diagnosis of PCOS, and her lab work did have higher than normal testosterone, which is a really important feature when diagnosing PCOS. Is something called high androgens, and she also had some cyst development, although not many cysts, but she was missing some other key features like insulin resistance or elevated insulin or other gut inflammatory symptoms that come along with the insulin component that comes with PCOS. And her testosterone was so low it didn't really show any of those characteristics that you expect to see with elevated androgen levels with normal PCOS. But upon further digging over like a 38-minute consultation before we were able to find loose pieces of information that were rare with her case, she was significantly overweight. She had like 150 pounds to lose, and she's lost 100 since getting the gastric sleeve. But despite that, her insulin levels and A1C levels for her blood sugar have remained normal. But as soon as she lost all the weight, she continued bleeding like she used to. But even more so, she now has spotting and loss of tissue, almost decidual casts, which are like the entire inside of the endometrial tissue coming out per cycle outside of the window of the period, which is really concerning. So then I said, do you have your thyroid levels? I want to check to see if I have something else. And despite being extremely overweight, she has hyperthyroidism, which is usually a presentation when people lose a lot of weight, and she had none of the other signs of it, but her levels were 0.3, which if you've ever looked at your thyroid panel is extremely low and almost not detectable. So that's a definite indicator of overactive thyroid. So it's very strange to see someone who has excessive weight gain, normal insulin, missing some of the key features of PCOS, but still these other issues overriding with Graves' disease or other hyperthyroid cases. So this one's super interesting. We've only just started treatment, but I'm assuming the thyroid will respond quickly. And if I could get the bleeding to stop, this will fix the infertility problem, which is that she's ovulating regularly. Her cycles are extremely regular despite the PCOS diagnosis, but she loses a tremendous amount of tissue throughout every cycle. So implantation's pretty impossible, even if the sperm and egg are meeting. We'll follow along and recap this case of the week and a few more cases, but this is an extremely unique scenario, and if you're dealing with it or dealing with one of these components, follow along for more.